You should never be chronically on anti-reflux medications. So let's talk about that. There's a whole conversation about acid reflux and GERD, but what we don't hear about is the utilization or misutilization, overutilization of proton pump inhibitors. Remember that the medications, proton pump inhibitor, stops only the acid production. But what it doesn't stop is the bile and bile acids that reflux into the esophagus, and they are just as potent carcinogens as acid. Acid reflux, or reflux in general, is a mechanical problem. At the end of the esophagus, beginning of the stomach, there's a sphincter-like mechanism that unless it contracts, you have reflux. You have things from the stomach that are reflux into the esophagus. So medication will not make this better. And medication can stop the acid production, but it does nothing to bile. Therefore, bile is still refluxing to the esophagus. Therefore, you may feel better, right? Because when they came the miracle drug, instead of having a big operation with big incisions, open operations, you could take the drug and feel better. But it did nothing to the bile acids. And now we find people that are coming into the clinic with esophageal adenocarcinoma and they say, I don't understand. I started with proton pump inhibitor once a day. Then I went to twice a day. Then I got scoped every single year. And now I'm told I have esophageal adenocarcinoma. I don't understand, what did I do wrong? Well, you didn't do anything wrong. In fact, we didn't know then what we know now, which is you shouldn't be on proton pump inhibitor chronically unless you have really other risk factors that makes it so it's better to be on a medication versus find the real solution for acid reflux. It's a mechanical problem that should be resolved mechanically, not with medications. And so the problem that we see today is increase in the incidence of esophageal adenocarcinoma, meaning since 1985, there was an increase in 8-fold of overall esophageal cancer. But for adenocarcinoma of the esophagus, there was a 56-fold increase, not 56%, 56-fold increase in the incidence of adenocarcinoma of the esophagus. So it's a serious problem, and that's in patients despite the use of PPI. So despite not having much of acid reflux, but bile reflux, which was just as potent carcinogen and is potent carcinogen as acid.